Welcome, everyone. We'll get started very soon. Well, Christine and Mary, do you want to kick us off?
Hi, welcome today. It's a beautiful day here in Wisconsin. Welcome to the Mental Health Task Force. I'm Christine Apple. I'm one of the co-chairs of the Mental Health Task Force, and I'm a psychologist with the Department of Corrections. Mary?
I'm Mary Neubauer. I am the co-chair of the Milwaukee Mental Health Task Force and represent the task force on the Milwaukee County Mental Health Board.
Okay, next I'll be going over the meeting ground rules in this Zoom environment. Thank you for joining us. Please follow these ground rules for our virtual meeting. Everyone will be muted throughout the session. We hope to have time after each speaker for a few questions. Use the chat feature to type your questions. We'll answer as many as we can. Sign language interpreters are provided at most meetings, including this one. If you need assistance accessing the interpreter, put your request in the chat. Speakers, please say your name before you speak to help with accessibility. Auto captioning is provided. You may turn captioning on or off. Click on the caret symbol next to the CC Live transcript button if you want to hide subtitles or to view the full transcript. At the top of your video screen, you can choose between speaker view or gallery view, whichever you prefer. Thank you today to our speakers for joining us today. We shared some questions in advance and appreciate their responsiveness to addressing these in their remarks. May is Mental Health Awareness Month, and the first week of May is Children's Mental Health Week. We are grateful that today you will hear from some leaders in children's mental health who are on the front line addressing the needs in our community. Okay, Mary?
In light of the topic, the Wisconsin Office of Children's Mental Health update we're going to have right now with Linda Hall, the director of the director of the Office of Children's Mental Health. And Director Hall will share an update on youth mental health, including the Office of Children's Mental Health Social Connectedness of Youth Agenda and Children's Mental Health Awareness Activities. Linda, I'd like to welcome you back to the Mental Health Task Force for what is coming to be an annual event for you.
Thank you, Mary. And I was thinking about that. It is kind of an annual event. I've been looking back and seeing the times I came before. I think it was, I enjoy the convenience of Zoom, but I miss being in the room with you and picking up on all the energy that the members of the task force emit when I am there. So, but today we'll forge ahead. I have a bit of a cold, so I hope my voice will carry on through all this. But I'm really pleased that you are willing to talk about children's mental health again. As you know, it's in the news a lot. There is clearly a mental health crisis going on. So what I want to do today is to share some information with you and to share some good news as well as the data around the current situation. So if Christine, I think you're going to pull up, oh no, Jeannie. It's going to pull up the slides for me. So with the next slide, I wanted to offer just a bit of an agenda. So I know that many of you have been at these meetings in the previous years when I presented, but I'll just touch a little bit on what's new at the Office of Children's Mental Health. How are Wisconsin kids doing? Some data mostly before the pandemic and some since the pandemic began. And then, as Mary said, talk about social connectedness, which is the one thing that we're going to focus on. Next slide, please. So our vision at OCMH is that children are safe, nurtured, and supported and that systems are family-friendly and easy to navigate, equitable and inclusive of all people. Next slide. Our charge is really to monitor the data related to children's mental health and recommend ways for the state departments and others across the state to coordinate initiatives and improve the children's mental health system. And the values that we hold dear as we continue with that work are listed below. Next slide. We have what we call the 3 pillars of our work. Data collection, paying attention to the data, hearing the voices of lived experience, and then approaching our work through collective impact. And we continue to hold these very close as we move forward in our work on children's mental health. Next slide. So these are some of the tools that we put out for you to use throughout the year. We have our annual report that comes out in January. We actually deliver it to the legislature at the very end of December, and then we do a briefing event on it in January. That annual report includes a dashboard of 30-some indicators of children's mental health. And then periodically, we issue fact sheets that provide more detail on an aspect of children's mental health that we think is important for people to be informed about. And with the fact sheets, we always put out a media advisory so that we are continually calling attention to children's mental health. Next slide, please. These are some of the tools that we have developed in the last year or so. And I think I just wanted you to be aware that they're available. We have a mental health crisis card that people can fill out that is helpful if you're in an emergency and need some help, and in the first 5 minutes, maybe you or the youth or the other adult who is having a crisis may not be able to verbalize the help they need. They could use this card. It can either be a paper card or it can be on their phone. We have in the middle picture on the top, you see a clip from one of our videos on parenting during the pandemic. We've got several of those. And on the upper right is the cover of our mental health literacy instructional units. So these are curriculum guides that we worked on with the Department of Public Instruction, people with lived experience, counselors, and teachers to develop, to really teach mental health. And so there are units for grades 3 to 5, for middle school, and for high school. So they are all available for free online. So if your school is not picking these up yet, you might take a look at them. They've been developed in ways that they can be used as part of the health curriculum in general. In the bottom left, you see our Accessing Children's Mental Health Services map. This is really for parents to take a look at if they're trying to figure out if their child needs mental health services. It gives kind of a way to get started in figuring out how you navigate that path to getting the help that you need. And then in the bottom right corner is our feelings thermometer, which is a tool that you can put on your refrigerator, and it can help kids identify what their feelings are and gives ideas of something they can do to shift their mood. What we're hearing from a lot of people is that parents are using this as much as the kids, and that adults are realizing that they need to have tools to think about how to talk about feelings. All of these tools are in multiple languages. The feelings thermometer is in 10 different languages. Typically, we do all of our work in English, Spanish, and Hmong. And the videos we have in English and Spanish. Next slide, please. As was already mentioned, last week was Children's Mental Health Week, and we issued new images this year. These were developed by youth who are working at Artworks Milwaukee in the internship program on graphic design. So we met with them, gave them some ideas about themes, and they developed these images that we've been sharing all week to encourage people to post on social media. Okay. And they're all available on our website if you'd like to download them. Just give me a minute here for my throat. Okay, sorry for the interruption. I haven't been talking a lot in the last few days, so I didn't know how this is going to go. So I want to do a little bit on how kids are doing in Wisconsin. So we'll jump into the data a little bit. Here we go. So in this slide, you see some of the ways that we kids are doing well in Wisconsin. 8th grade high school graduation, 8th grade math proficiency. Clinical care access is improving. It's not enough, but it's improving. And the workforce capacity, we've seen there is an increase in providers. Okay, next slide, please. There's plenty of places where we need to improve. These are some of the ones that we've identified. You see this information on our dashboard. I will go into these areas for improvement in a little bit more detail. Next slide, please. I wanted to share with you a little bit of information that's really Milwaukee related. You know, we use county health rankings for some of the ways that we monitor kids' well-being. And so I wanted to show you some of these factors for Milwaukee. The information in the center 4 categories are the categories that we focus on. And you'll see that while Milwaukee is not doing terribly well, it's not at the bottom either, except for the quality of life. Because this is county rankings, and there are 72 counties. So I wanted you to at least have some comparison for some children's mental health issues. All right, let's go on to the next slide, please. This is an area where we have a lot of concern that children are having increasing difficulty with social skills, the ability to make relationships and retain them, and social connectedness is declining. So this is a really foundational piece to what we are focusing on now. Next slide, please. Another area that we're concerned about is that the anxiety and depression and self-harm is continuing to rise. This data, as you can see, is 2019. It's all pre-pandemic. And you see that there's been a steady increase in depression and anxiety and feelings of sadness and hopelessness. We don't have strong data yet since the pandemic, but we expect to see that it has risen. Next slide, please. Suicide's another area that we unfortunately in Wisconsin are higher than the national average. And you can see on the left here that we've been above the national average for a number of years. If you look on the right, you'll see that suicide attempts have been increasing, especially for Black youth. And that is both male and female Black youth. So a very concerning trend. And then the next slide also is on suicide. I wanted to give you a little bit of a breakout around LGBTQ data related to suicide, and you can see that it's much higher than that of hetero high school students, 3 times as high, and more than a quarter have attempted suicide, and that's 5 times the rate of hetero kids. I was this morning reviewing the 2021 Community Health Needs Assessment and found a little bit more information on health insurance. Excuse me. So I found a little bit more on health insurance and found that in Milwaukee County, 95% or more of all groups were insured, but except for the Hispanic Latinx community, which has only 88% insurance. And of the people who responded to the survey, 50% identified mental health as the most important community issue in their community. And that was in comparison to other things like chronic disease and drug use and alcohol. And in a separate question, access to mental health services was identified second to affordable health care and ahead of affordable housing, gun violence, community, and safety. So I don't know that the people who responded to the survey are entirely representative of the Milwaukee community in whole, but I think that it's interesting that mental health is really seen as an important issue and should really, bolster us all in terms of our advocacy around mental health, that this is a time for us to really be speaking about it and making a difference. Next slide, please. So a little bit about the pandemic. Next slide. The kids who are most affected by the pandemic are those whose families have lost income, education online, and childcare disruptions have been a problem for kids. And when their parents are stressed, the kids are more stressed and more anxious. Next slide. So these are some more detail on how some parents are exhibiting stress. Alcohol related sales increased, opioid deaths increased, and domestic violence deaths have increased. Next slide, please. So we don't know the full impact of the pandemic yet, but we do have anecdotal evidence that from emergency room data and mental health claims showing that the pandemic has been hard on kids and on mental health. There's been a tremendous increase. And mental health emergencies at hospitals have increased, and they jumped in the first 8 months of the pandemic alone. Next slide, please. With this slide, I wanted to get a little bit more into connectedness. And here you see that when kids are connected, their suicide attempts go down, their serious consideration of suicide is less, their sadness and hopelessness is less, and their poor mental health days are less. And that was also true in the pandemic. So we know that connectedness is really important for kids. Next slide, please. This is another way that we represent the social connectedness of kids. You see that there's different ways that we can measure this. So we get this primarily from the National Child Health Survey, which shows that different levels of how much kids are lacking connectedness. The ones that we are going to focus on are whether the family shares ideas. We think that's an important thing for us to monitor. The 40% of kids do not live in a supportive neighborhood, and 55% don't engage in community service. And that is also a measure of well-being for kids. So just another little angle on social connectedness. Next slide, please. So clearly kids are struggling, and we're looking at it across the lifespan and identified for each of these segments of the lifespan of a child that we look at, we identified one of the major concerns. With the 0 to 5 group, it's that unrecognized mental health issues contribute to preschool expulsions. The 6 to 12-year-olds, that issue of kids not being able to make and retain relationships is critical for their feeling like they belong at school, but also for their connections with teachers and learning. Suicide or the lack of belonging is contributing to teen suicide rate. And then with the older 19 to 26-year-olds, our concern is the support that they need and the continued mental health treatment that they need in order to launch as healthy adults. Next slide. So actually, one of the questions that was submitted earlier on was about barriers to treatment. And these are the ones that come to mind for me that I'm always talking with people out. The professional shortage, not enough school social workers and counselors. High deductible health plans is a major problem for kids and getting school mental health. Insurance networks limit service at school and through telehealth. And then the complicated screening and paperwork continues, and so does stigma. We really need to move, as Mental Health America says, to a before stage 4 system, and we don't have that yet. Next slide, please. Okay, good thing I'm not in the room with you, huh? All right. The issue of mental health being a crisis is not just ours in Wisconsin, it's across the nation. The Surgeon General issued an advisory in December talking about it and issued this report. It's a very good detailed report on ideas of what we can do to make a difference. Next slide, please. And there are others paying attention to youth mental health and planning more investments in it. President Biden has announced a strategy to address the national mental health crisis. It has a lot of information in it, a lot of good information about youth and ideas about what the government can do. The Senate Finance Committee has a bipartisan group of senators working on assessing the situation, and now they are now working on a legislative package that they plan to announce in the summer. So we're looking forward to that. As advocates for mental health, you might be wanting to engage on this issue and make recommendations to the committee. If you want the information on how to get your recommendations to the committee, I'd be happy to share that with you. I did want to mention that the president's report includes some good information about children not receiving adequate treatment, not new information. It just confirms what we already knew. It does say that it offers some new information that school-based interventions have been found to improve mental health outcomes and reduce substance use among youth, and youth are more likely to seek treatment at school. It also provides some pretty detailed information on the disparities in mental health treatment and access to treatment. So it's good that all of this attention is being made to mental health, and we hope that we'll work together to make sure that it ends up in improvements in the system. Next slide, please. At the state level, here are some of the ways that we've been investing in mental health. In the state budget, the biennial budget for this session, there have been increases in funding for student services staff. So that's those counselors and social workers at schools. There was an increase for the mental health collaboration grant. And then there have been some large investments from the pandemic funds. So that's the ESSER funds and the ARPA funds. And then Governor Evers recently designated $15 million in flexible funding for K through 12 school mental health and $5 million for the UW system. And this was really, the allocation turns out that for Milwaukee Public Schools, the allocation is $966,436. And that, unlike with the other grant programs, it was just a simple form to fill out, and then the money comes to the schools. so we welcome the ongoing investments. We still need, I think, more ongoing investments. The pandemic money is short-term, as you know. So we need to figure out how we can get the kind of investments that will allow schools and communities to continue the kind of work that they're developing right now with these pandemic funds. Next slide, please. So these are some of the reasons that school mental health works. I think they're pretty obvious to you. It's easier access to school, reduced missing of class time. It's easier on parents. We also like to say that it is really helpful because school staff, as they interact with the mental health therapists, they learn things that they can generalize and use with other students. So it really helps to get more mental health awareness and mental health literacy across the school staff, which is important. Next slide. We had several listening sessions with youth over the last couple of years and asking them, like, what did they think that we should be doing around mental health? And the information we got from those sessions was distilled by our resiliency work group that then boiled them down into what the students told us. And these were the primary themes that they had. I'm gonna give you a second to look at those. What we hear a lot from the youth is that we know what's needed, and we want to be part of the solution. And I would say that of all these things, I think what I hear most frequently is that they really want more staff at schools to be comfortable and equipped to talk with them about mental health. Next slide. Another area that we're looking to focus on is where are youth leading in mental health? And so we have updated our youth mental health programs map that is on our website. And you can see this here. We're going to keep updating it. I will say that what I see on our map here, Milwaukee, is that there are 5 programs in schools. And those programs are either Hope Squad or Red Gen. Another program that is being brought up in a lot of schools is Sources of Strength, which is one that I think is really holds a lot of promise because it addresses preventing suicide, which is where it was originally designed, but then it also it works with staff at school and youth to really create positive norms and improve the school culture, which is important for kids' belonging. Next slide, please. So back across to this issue of kids across the lifespan are struggling. We looked at this, then we looked at data, we talked to our network, we talked to people beyond our network, and we said, if we want to approach this, make a difference for all these kids, and if we're going to do this from a collective impact kind of way, what's the one thing we need to do? Next slide, please. And so the one thing that we decided on, after we looked at the data, we talked with people, the one thing was social connectedness of youth. Next slide. And here is our working definition of social connectedness. It's based upon a CDC definition, but it's Wisconsinized, so to speak, for our network. Youth are socially connected when they are actively engaged in positive relationships where they feel they belong, are safe, cared for, valued, and supported. And in the diagram here, you see in the center 5 categories of connectedness that we think are important. And the outside circle represents some of the systems that we want to work with to make a difference for kids in their connectedness. Next slide, please. So of the 5 categories, we have decided to focus on 3 where we think that our network has the most to offer, and the ones that need more leadership than some of the others. The early childhood and school are really important, but we think that other people are better positioned to lead on that. So what we want to do is lead on family, supportive adult, and cultural identity community. And here you see what our initial vision is for what each of these impact teams or work groups will work on. We are currently recruiting people to be on these teams, and we have purposely not built out our whole work agenda or strategic plan because we know that we need more people in the room and at the table before we make all those decisions. So we are looking for people right now who want to work with us on one of these teams, and we think we'll be starting meetings of the new teams in June. In addition to this, we are going to be running sort of parallel to this, to the impact team work that will be, involve, real activities and work on policy solutions, perhaps. In addition to that, we plan to be running a messaging campaign around the importance of social connectedness, and also lifting up what communities are doing already to connect their youth, and lift those things up so that other communities can get ideas about what they might do. Next slide, please. So here we are. This is what we think is really important. And I'm happy to answer some questions, but I'm hoping also that at some point, you can tell me what you think about the social connectedness of youth in your community, what you currently are doing, and what you think could help. So I hope that we can have some dialogue about that. If not today, maybe at an upcoming meeting. But we really want your help and join in helping us build this agenda. And I think my contact information is on the next slide. And with that, I'd be happy to answer some questions. And I'm going to stay around. So I'm really interested to hear the other speakers today. So if you want to have discussion later, I will be here for that.
Mary, I see one question in the chat and I just oh, here it is. This is from Denise Johnson. I am curious, are these kids with mental health involved with IEP that would help these children? I also learned from another source that school counselors, social workers are bringing up the children's mental health issues to their parents because then it would be on the school cost to provide the services for the children. If yes, why? Thank you, Denise.
Yeah, when we talk about kids, we talk about the whole range of kids, including those who have IEPs, but and other kids in addition to that. The issue of schools not wanting to talk about some things with kids because they're worried about what their responsibility will be, I think that's an issue that we have had experience with for many years. That it is a concern at times. But I will say that there is a lot of strength being built in school mental health. There are more people working on it in lots of schools. Charlie Bauerfeind is one of the folks that we work with a lot. Children's Wisconsin has a lot of school mental health folks, and I think that as people can feel like it's not an overwhelming issue, that there is some support for them to work with kids, I think that we can get more kids some help. But let me also say that this social connectedness of youth agenda is really, it's not, it's in part a response to the fact that the demand for mental health at school is still far exceeding what we're able to provide. I see Charlie nodding his head. It's still in the K-12 area and at college campuses, it's just far exceeding what we're able to provide. And so that was one of the things that we looked at. It was like, if we're going to make a difference for kids now, what can we do that will make a difference? And we just kept coming back to this issue of belonging. Belonging makes a difference. And it's something that so many people can be involved in. You know, being connected is important, not only for the kid, but for the adult. And there is data that shows that as little as a 40-second interaction between two people can reduce isolation and loneliness. These are important things. This is important evidence for us to pay attention to. So as I talked about our messaging that we're going to do, we're going to really be focusing a lot on this, like what more can other people be doing to help kids feel connected so that we head off some of what's been happening for them, the disconnection and it's with disconnection, with the lack of belonging, that kids engage in more risky behaviors. And if we can head off some of that, we'll be in a much better place. We are also, I want to mention this because I know that many of you work not just in children's mental health, but in adult mental health. We are collaborating with the Coalition to Reduce Social Isolation among older adults. And we're going to be we are really working together to figure out what kind of 2-generation approaches we can do in this area. So I'm really excited about that.
Okay, 2 more questions. What is being done specifically with MPS schools to help address and ameliorate this children's mental health crisis and improve connectedness? And have they been responsive? And if so, in what way?
Boy, I'm wondering if I could turn to Charlie for that one. I'm not sure I can really speak for the Milwaukee Public Schools. I have some awareness of that people are involved, but I can't really speak to that. Charlie, do you have some comments on that?
Sure, I'd be happy to speak representing Milwaukee Public Schools. The district is trying many new and evidence-based approaches to reach students and meet the emerging and unmet mental health needs. We have violence prevention programs, social emotional learning. We have a robust crisis team that works with students in crisis that have suicidal thoughts. Unfortunately, we have a lot of shootings and that type of thing that the crisis team works with. And we also have one of the largest school-based mental health programs in the state, SCPMH, where we're at 38 different schools, bringing mental health providers right into the school to work with students that otherwise wouldn't be able to get those services. The services are provided by our mental health community members. So it is a true partnership. MPS provides space, but no funds to do the work. So our agencies come in to work with the families, the students, and the parents and teachers. I always talk about the multi-tiered systems of support, and that's how our mental fitness program ties in. Everyone wants to focus on students being seen for mental health, which school districts can't do. We're not hired to do mental health. So we partner with outside agencies coming in, again, 38 schools, but those clinicians also work at tier 2 and tier 3 to really change the trajectory, talk about social connectedness, decrease stigma, and increase wellness. So a lot of things are being done. The ESSER funds have brought the ability to do some of these programs. Every MPS building has a school social worker and psychologist. And we're going to be getting trained in DBTA as well as CBITS in August. So just a real robust mental health outlook, as well as partnering with our community members to change the trajectory for our students that are experiencing some significant mental health needs. I hope that answers the question.
Thank you. I know we're a minute over time, but I just want to get this in. I think it's important. This is from Cindy Freeman. A question about cultural diversity and culturally appropriate services for the kids. You could make a comment on that.
Yeah, of course, we're challenged in that area. We just don't have enough therapists and mental health professionals from culturally diverse backgrounds. Our office has been hosting listening sessions and lunch and learn sessions with people from diverse backgrounds to try to create more support for these folks, so that because they identify that there's a lot of they have a lot of difficulty operating in the current systems. So that's one of the things that we've been doing. We're of course always advocating for support for people from diverse cultures to be able to get into mental health school. I mean, college programs and master's programs, so that they are equipped to provide these services. I think the other area where we think there's a possibility for increasing the support of people with a good culturally diverse understanding is to really support peer specialists and parent peers. And so we are looking to see how can we get more of those people actually paid for those services, certified and paid for those services. I really look at this as we are in a crisis. We cannot wait until there are enough people trained to be outpatient mental health therapists. We need to do what we can now. We need to be thinking about kid time, not long-term implementation time. And so that's really why we're turning to what can everybody in communities do right now to make a difference for the kids in their lives.
Thank you very much, Linda Hall. We're going to turn to the next speaker right away, continuing the theme of mental health services for youth. Brian McBride, Director of Children's Community Mental Health and Wraparound Milwaukee, and his team. Welcome, Brian.
Thank you. Glad we could be here, and thank you, Linda, for presenting that information. We today want to take some time to give a current landscape and give some information in regards to the current services that we offer through our system of care here in Milwaukee County. We also want to be able to address some of our current initiatives that we have with No Wrong Door, children's integration, as well as provide updates on different levels of service that we have. So we look forward to being able to share this and answer some questions if there are any at the end of the presentation. I do have Maria Castillo with us today to be able to walk through a PowerPoint presentation, as well as sharing some of that information. Maria is our community outreach coordinator. So without any further ado, I will turn it over to Maria to share our information.
Great, and thank you for having us. My name is Maria Castillo, as Brian said, and I'm the Community Outreach Coordinator for Wraparound Children's Community Mental Health Services in Wraparound Milwaukee. I would like to share the PowerPoint, but it says that the host is disabled, so can someone let me do it? But I'll go ahead and get started in the meantime.
Yep, I'll take care of that. Thought I had you up. Sorry about that, Maria.
No worries, no worries. So for those of you who don't know, Wraparound Milwaukee has been around in the community for over 25 plus years. Believe it or not, I was at a presentation earlier and there were a handful of folks that still didn't know that we existed. So hopefully we can all spread the word. Wraparound Milwaukee is really designed to help and work with families to keep them within their community, within their homes, really trying to figure out, what it is that the family would like to work on, and really trying to wrap those resources around that family by their choosing, based on what it is they want to work on, based on what is most comfortable for them, and really trying to address those mental health needs as well as other needs that families may come to us with. Regardless as to which program that a family might be involved in with us, or even some of our informal services and supports, we do follow what we call the 4 H's, and it's really kind of like a large marble cake, as I call it, with 4 different colors. So if you think of a marble cake with 4 colors, we would be looking at our hello, help, healing, and hope, and just looking at, how do we build a relationship with this family? How do we let them know that we can handle what it is that they're bringing to us? And how can we instill that healing can happen and that hope is real? And then hopefully building a plan with them that is something that they can carry on without us, But if they do need further services and support, how do we get those in place for them so that they can continue their progress and success? And if they need other levels of care, get them connected as well. Okay. You guys should be able to see my screen now. And so what you're looking at right now is the wraparound system of care. We call this a schematic. So really, if you look at the middle section, this is where you would see our prime, like our main programming options. So we do have comprehensive community services for children. We do have our court-ordered wrap program, our REACH program, and we also have our core program, which focuses in on psychosis. To the right and to the left, you'll see some of the peripheral services and supports that we do offer, such as our wellness clinic, our youth crisis stabilization facility, our FIST program, family and educational advocacy, and Owens Place, and those pieces and such. Offering a wide variety of resources and just kind of figuring out the different levels of care that families may need. I think this is a great visual for folks who are trying to put together, like, what are all the pieces of wraparound Milwaukee and all the behavioral health services that Milwaukee County offers for children. Is a great picture that we can look at to kind of organize us. Within our main programs, you will see, as we call it, a continuum of care. So we might have individuals coming from our court-ordered wrap program, which is a high-level intensity program that sees their care coordinator about 1 time a week, moving to different levels of care, such as like our CCS program, which is more of a maintenance, recovery-based program, which is a different level of intensity. We do have our Youth Connect program as well, which is designed for individuals who are not part of any programming. So we might have individuals that come via the hospitals or however, who are not part of any child welfare system, any children's court system, disabilities, or any kind of social service programming. And these individuals might be in need of like some short-term crisis management services. And this might be an opportunity for us to service them, as well as prevent some kind of further system involvement or some kind of further hospitalization and things. We also do operate our core program, which is designed for individuals with clinical high risk for psychosis or individuals who have already experienced their first episode of psychosis. Within these programs, we are able to service individuals between the age range of 5 and 23. And when we have families that come to us for services and programming, we are able to do options counseling with them to figure out what it is that they need at this point in time, and then what level of intensity are they looking for, or specific services and supports that they might need to handle what's going on right now. It doesn't mean that they have to stay within that individual program. They might start or step down, or however in between the different levels of programming, which is nice to be able to offer that to the families that we serve. So when folks are thinking about like, hey, when should we possibly, give this resource to a family? If a family is struggling, let's go ahead and get them connected. We might have individuals that do or don't have a treatment history, maybe have been on medication in the past or currently. Individuals, like, we're not sure if they have a diagnosis or not. Sometimes families don't want to tell us all of their business. So maybe we could just go ahead and give them the resource and referral line number, and then they can explain their story to that one particular person to see if they start qualifying for programming and such, and see if there's other resources that they can get like right away. And that's usually helpful for families, because then they don't have to repeat their story and things like that. If we do have other children in the home that might need some services and support, so maybe you're working with maybe a 15-year-old, and then you notice like there's a 6-year-old who maybe is struggling, or maybe there's a 1 or a 2-year-old who's struggling, maybe we can start getting those folks connected by having the families call the resource and referral line. And why that's important is if we can hopefully catch those individuals as they're younger, maybe we can prevent further system involvement as they get older. And because we are in a partnership with what was formerly known as Disability Services Division, where we are doing dual screening, partnership screenings for birth to 3, CLTS, and the CCOP program. So keeping that in mind, that if families call our 257-7607 number, we are able to go through not only all of our programs, but the screening staff can also help with the other programs that Milwaukee County offers for children as well. I will give a quiz at the end of this presentation. So you need to write down this number, 414-257-7607, and I will make sure that everyone here knows that number by the time we are done. Concerns or behaviors in school, home, or the community. Definitely we want to get these individuals connected so that we can hopefully get those concerns taken care of sooner than later. As I talked about just a second ago, referrals and options counseling. If you have a family that you're working with and the family needs some services and support, or they want to know what their options are, or they want to know how things work, definitely have them give us a call. Even if they call us, they are not locked in with having to join a program or go any further. It's definitely up to them. We want them to own this process from the beginning because the more invested they are, the more that they want to do this, the more change that they will make. So definitely have families reaching out. We do have a Spanish, like they can just hit #2. And if there's any other language that a family is in need of, definitely help and assist with that, because then we can go ahead. We do interpretation, sign language, all that from the screening process all the way through the service process. So we definitely want to make sure that we can meet families' needs if they need that as well. Even by calling our resource and referral line, there's a number of different resources that families can have access to, learning about evaluations and services, specifically for kids on the autism spectrum, learning about child find and special education referrals. That's a huge one. Families are just kind of like learning about that and, how do we get them connected? I call the resource and referral line coordinators kind of like a live Google search, because we have families that just relocate here and they end up calling our resource and referral line and they need a number of different resources. And Craig and Vanessa do a wonderful job of like just figuring out some different things. What are some resources? How can we get these families connected to help as much as we can? And we also filter through a number of other programs, including our FIS program. And we do have a direct connection, so we can easily get families connected to FIS as well. And then the CYFS programming options are also part of our options counseling. So that's the birth to 3, CLTS, and CCOP. Also, another biggie is for families who have private insurance and maybe they need help learning more about Katie Beckett. So Katie Beckett, for those of you who might be aware or not, this is designed for individuals who maybe typically don't qualify for Medicaid, but maybe they have exhausted everything for their child with their private insurance. So multiple inpatients and day treatments and having, done a large amount of therapy. These might be families that would benefit from having Katie Beckett. So in between our programs and our entire system of care, we might be able to provide some short-term support while helping the family apply for Katie Beckett and just a number of different things. And we also have young adults, because we do service up to 23, and helping those young adults, like maybe they're starting to experience psychosis at the age of 20. Maybe they were working very productive jobs. And now they're like, you know what, I lost my benefits. I lost my job. I don't know where to start. And these individuals usually don't know that they qualify for Medicaid. So we are able to help them through the process of applying for Medicaid, which would then help them, become eligible for our services and supports and pay for their medication and things like that. So definitely keeping our phone number, once again, 257-7607, as a resource number for not only our programs, but also other resources and access to different, needs and supports that families may have. If folks call us and they need information on adult programming and options, Craig and Vanessa do a really good job with connecting with our CARS department out at Behavioral Health Services to talk about, the CARS options that are offered for adults in Milwaukee County as well. Another resource, so Owens Place, which is our free community-based drop-in center for youth between 16 and 24. If you have not been at Owens Place, you definitely have to stop by. This is where our grab and goes have been hosted once a month. We started these in May of 2020, and we did them through November that year, and then we brought them again last year. And then we also have brought them back again this year, starting in March, and we'll go through October. And I'm going to show you the flyer for that at the end. So make sure you have your camera ready. And I think as a presenter before me was referring to like offering opportunities for connectedness and opportunities for social interaction. And I think Owens Place definitely offers that. And when we talk about our grab and goes, that is definitely something that has been well received by the community. And we have people just stopping by. They do not have to be part of our programs, but if they are, great. But if not, just come out, talk a little bit, get some resources. And really, this has been a different way of approaching mental health. We do have about 3 clinicians that are part of the grab and go event. But bringing people in and talking about like, oh, we have these different resources, we have free clothing, we have free food, we have different things that we can give you. Just come on over, bring the kids. And then when they get there, we start to learn about, do you guys have any resources on domestic violence? Oh yeah, are those gun locks? Because we do carry the gun locks, we do carry the pill disposal kits. We have had just a number of different things that we can carry. And, just saying, hey, is there anyone in the, that might need a gun lock? We don't want to know who it is. We don't want to, you need 1, you need 2, just take it with you just in case. So just really trying to use it as a different way to approach mental health and getting some different resources out to the community. So I will share a picture of that at the end. We do have a youth crisis stabilization facility, which is in partnership with WCS. It's a very short term, about 3 to 5 day stay. And this is for male youth between the ages of 10 to 17. And the referral line for that is at the bottom. But if you need more information, you can always call our 7607 number as well. We do have our website on here for you, where you'll find a number of brochures and things like that. Right now, Milwaukee County, so this is in partnership with CYFS, Behavioral Health Services, Disabilities, Housing, all these. If we have someone who's enrolled in any kind of Milwaukee County program, including our Children's Community Mental Health Services and Wraparound Milwaukee program, and they're between the ages of 14 and 24 years old, we pretty much have guaranteed opportunities for employment. So care coordinators for our programs get a reminder about this about every 2 weeks. We did do a lunch and learn. This went to agency heads and things like that. But if folks are working with somebody who's involved in a Milwaukee County program and they're between the ages of 14 and 24, and you have any questions, you can always reach out to me on this as well. You have my contact information. So I go out and do presentations, resource events, getting people like the hard copies of information, doing presentations virtually like this. Just reach out to me and I can definitely get that for you. Some of the things that we're doing, and I'm going to switch over a little bit here. We do lunch and learns for the community. So this could be parents, this could be different agencies or however. We do about 6 to 8 of these a year. And our next one that's coming up is on June 23rd. So if anyone knows Dr. Dykstra, this is really to give people a taste of like recognizing the symptoms of psychosis and really how to get people the help that they need as fast as they possibly can. So please spread the word on this. And we will be doing this virtually so we can have as many people as we possibly can to learn about psychosis. Our grab and goes, which are held the last Wednesday of each month. The next one is going to be May 25th. And once again, people can just stop by. Anyone in the community can stop by. So if you're curious, come on by. I would hope to encourage people to start doing things like this on their own. It hasn't really cost us much of anything because our staff has donated a ton of items and we're able to partner with other agencies and we have donations coming in from stores and things like that. So we can offer just a number of different resources. And when we're talking about like that pandemic effect, I really appreciated like the acknowledgement of stress and the economics. And it's so nice to be able to offer families like boxes of cereal and, you know, cake mixes and things that they can do with their kids or offer something that maybe a family would have a lot of stress on, maybe, you know, not being able to offer their kid a snack or something like that. So it's just been really great to do these. And I encourage folks, if you have things that you're looking to get rid of, start a grab and go at your church, start a grab and go, you know, with a community partner, do something. So I definitely appreciate that because I just feel like they're so needed. And tomorrow we are having our Wraparound Milwaukee Wellness Fair. So that will be outside of Owens Place and that will be tomorrow from 3 to 5. So it's kind of short notice, but definitely if you would like to share that, please go ahead and do that.
Maria, if you wouldn't mind, this is Barbara. Thank you so much. I know there's some questions, but if you wouldn't mind taking down the share screen, that might help with the accessibility for seeing the interpreter and everything. Thank you so much.
Oh, sorry.
No worries.
Thanks, Maria. I appreciate you running through the PowerPoint and explaining every part of our system of care and the development that we have. I want to take a few minutes here. Be mindful of time and the presenters coming up, so we'll certainly go through what we can to fill the time and then give some time for any questions afterwards. But we are, for those who aren't aware, DHHS and Milwaukee County are going through a children's integration, really taking what was previously youth disability services and our juvenile justice programming and moving that together into children and family services. Our Wraparound Milwaukee and the children's mental health area are working side by side with those partners on this integration. We are still housed under the behavioral health services and will continue to be that way for the time moving forward. But we are really working from a children's lens to ensure that we are connecting families with the needed services, but also doing it in an efficient manner that is, again, assessing the needs as well as ensuring that they have access to service. And this really falls under Milwaukee County and the DHHS's no wrong door process and philosophy moving forward, that no matter where you enter our system or wherever you connect, you are going to be able to get connected and get the service that you need. If you go through a housing resource, but are looking also for mental health services, we are striving to be able to connect individuals that way. So on the children's side of service delivery, what has happened is that, as Maria alluded to, the previously known Wraparound Milwaukee screening team is now called the Children's Intake team, meaning that we are doing this screening and assessment for all of the mental health services, but as well looking into the CLTS birth to 3 disability services programming as well, so that we can really provide those options. And this has really been built out of the comprehensive community service and CLTS options, being able to merge those services and be able to provide both programs to families and really how they access. We wanted to make sure that they get those services. So when we started looking at where those connection points are, we certainly wanted to be mindful of those moving forward. So children's integration is moving forward. It'll continue to progress over the coming months and years to be able to be all-encompassing and provide that efficient flow of referral, but also service delivery, and really aligning all of the children's programs in similar ways moving forward for those services. What I also want to take some time to expand on is Maria in the presentation also did talk about the youth crisis stabilization centers, and what we are really happy to be announcing soon is the opening of the girls YCSF, which will be a 4-bed psychiatric respite, high level of need respite center that we are partnering with Lad Lake to operate. We hope to have the license in our hands in the coming weeks to be able to open and start providing that service. WCS does provide the boys youth crisis stabilization center. So this is just an expansion of that with a new vendor, but we are really looking forward to providing that need and necessity of service and support through short-term respite stays, where right now our average stay on the boy side is about 5 days. It really helps with placement stability, the ability to intervene with mental health services in a different way to stabilize behavior, as well as give caretakers, placement providers needed assistance in some of these situations. What we are, one of the last updates I'll provide is that we are in the process of moving what is known as our Wraparound Wellness Clinic to a community-based location on 19th and North Avenue. This is where we will provide our community-based psychiatric and medication evaluation services, as well as look to expanding our therapeutic services and substance abuse services. We're excited that we are able to take some of our state funding and really look to bolster community-based services. So while we are going to expand the number of kids that we serve from our medication clinic standpoint by 300, 400, 500 kids in a given year, be able to give that resource that is much needed in our community, but also look at different ways to support youth and families coming through there. And we're really excited to be able to really focus in on some of the substance abuse needs of our youth and families, and really have a dedicated staff present at that clinic, as well as look to enhance our current provider networks to really move forward on some of those much needed substance abuse treatment options for youth and families. So we're really excited to be able to move some of that service forward. On our youth crisis, mobile crisis teams, we are currently in the process of really working with our adult mobile team to do joint response, to be able to assist with what was previously adult and youth mobile teams, but really do joint community response. And that has really come out of our need to be able to ensure that we have adequate response, given the pandemic and the current workforce struggles that we have seen, and a lot of others have as well. We have seen that our youth crisis side of service certainly needed to be prioritized because of the lack of staff and availability. So we are doing some of this to really enhance our service delivery at this current time, but also position ourselves for the future to really look at a unique way to partner with our crisis mobile team. So we are in the process of adding staff. We are going through the process of ensuring that we have adequate numbers of staff present. But we do always want to say at this time that we're doing our best in a really tough situation of workforce, as well as crisis response and need in our community. So we're trying to address things in a different way. And our Youth Connect team and our crisis mobile teams are just one way that we're looking to provide a different level of impact in the community. So I know we are getting close to time. So Barbara, I think I will stop at that point and see if there are any questions or anything more specific that anyone would like. Otherwise, we can certainly be reachable and have people ask questions at a later time.
We're at time, but I'm just going to mention one comment and one question. Then you can reach out to Brian McBride after. I just heard him say that. Maria, and she got shortchanged last time. She once made a comment that you should. There's a plan in Madison to bring STARK, S-T-A-R-K. I don't know the acronym, but maybe she can talk to you more about that. Okay. Melanie Cairns, how about Child Protective Services? Is Family Child Access also integrated with wraparound? We'll end with that.
Well, I'm sorry, say that question one more time. Child Protective Services?
Yeah, is Family Child Access also integrated with wraparound BHD?
If I understand the question right, no, right now it is not integrated, as the child welfare system in Milwaukee County is still state operated, and the behavioral health services and children's integration are all county run programming. What I will say is that there is active partnerships there. We continually meet. They are aware of the integration process. They are a partner at the table. We knowing how much child welfare, behavioral health, and the juvenile justice system has to work together to meet the needs of youth and families. So while it isn't a part of the official integration, they certainly are a part of the overall conversation in planning.
Thank you. And you probably, I don't know if you see this in the chat, but may we send you the questions, Brian and Maria, and we can share the answers on the listserv? Barbara.
Absolutely. Absolutely.
Awesome. Thank you. Mary?
Yes, great. I'd like to welcome Jude Kubicek, the Vice President of Behavioral Health Service Line from Ascension, Wisconsin Behavioral Health Services, for an overview this afternoon. Jim, welcome.
Thanks. It's great to be here. Lots of familiar faces I'm seeing on the screen, so it's like old home week for me. So I wanted to just take a couple minutes. I don't have a slide deck, but I just wanted to kind of take a couple minutes to just talk about Ascension services and some of the shifting of services that we have undergone in the very, very recent past. So before I get into that, I'll just talk a little bit just to give you a 1,000-foot kind of overview of the services that we're currently providing. So Ascension has 5 hospitals, 5 inpatient psychiatric hospitals kind of throughout the state. We have a hospital up in Appleton, a hospital in Oshkosh, and a hospital in Racine, our All Saints Hospital. We have 2 of those units have child adolescent inpatient units, and then all the rest are adult inpatient units. And in Milwaukee, in order to increase our behavioral health capacity, we are relocating some of our capacity. So as many of you are aware, we had a inpatient unit at Columbia St. Mary's, Milwaukee. We have moved those beds over to kind of a split between the St. Francis location and the Columbia St. Mary's Ozaki location. Really, this is has allowed us, this kind of shift in capacity has allowed us to expand our staffed capacity of beds. As many of you who are in operations are aware, staffing is a major barrier to reaching full capacity, not only on inpatient, but on outpatient levels of care as well. So what this has done, then, operationally is really allowed us to, as I said, expand the inpatient capacity, but also along with that to significantly increase our outpatient capacity at the Milwaukee campus. We have made some pretty significant strides over the last probably 6 to 8 months in terms of our access to outpatient medication, treatment medication for at all of our outpatient sites. I'm going to say 8 months ago, average wait time was between 3 and 5 months to get an outpatient appointment. And we've reduced that down to 2 to 4 weeks at most of our sites throughout the state. Excuse me. And that will increase, that access will increase even more once we fully open that Milwaukee location. So that the Milwaukee location is right at the main Columbia St. Mary's Milwaukee hospital over on the east side of Milwaukee. So one of the things, in terms of the service array that, in addition to our inpatient sites, we have, I believe, 10 outpatient high intensity PHPs and IOP programs and about 35 outpatient clinics throughout the state of Wisconsin. Probably about 70% of those are in the Milwaukee and the Milwaukee area location. So we have a pretty robust outpatient access to behavioral health services. One of the challenges that we're continuing to have is access to outpatient psychotherapy. One of the questions that was asked is, I think, what would we do, or what would I change if we could change something in the behavioral health system? And that's really I think Linda talked a little bit about this earlier, is the access to a workforce is a major issue for us. It's no longer just nurses. Now it's access to those master's level clinicians who are doing the outpatient psychotherapy work. The blessing and the curse of an increase in access to virtual care is it provides a lot of options for individuals to get outpatient care, but there's a lot more competition for those master's level clinicians, and that they're going to these, many of which are national providers, to get outpatient services, and they're almost exclusively, these larger providers are only serving commercial payers. So it really has restricted the pool of available clinicians who are ready, willing, and able to serve that underserved Medicaid population. And that's really what Ascension, that's a mission of Ascension, is serving that poor and underserved population. So it's a real problem. There's kind of the two attributes of being a viable provider, and that's accessibility and sustainability. And there's a number of factors in both. There's a number of factors that are involved in being a good and accessible provider and in being a sustainable provider. One is obviously making it a sustainable from a financial perspective, but also sustainable from a staffing capacity. That's really what I wanted to kind of talk about. The other things that we're doing in the service line that I'm particularly proud of in the recent past is we have expanded our use of recovery coaches into all the emergency rooms in the Ascension network. So all 10 of our inpatient critical access hospitals now can get access to a recovery coach in the emergency room 24 hours a day, 7 days a week. So that's pretty cool. We just were able to start that in all the sites. It's only been about a week now since we've been in each of the sites, and we've kind of titrated into more and more hospitals kind of over the past month to 6 weeks. So hopefully what that will do is as folks enter into emergency rooms for perhaps a substance-related medical condition, overdose, intoxication, they're able to connect with a recovery coach regardless of the substance that they're using. So our Ascension Foundation is covering the cost for anybody with alcohol. And we've got some grants to cover anybody with opiate issues. So regardless of their drug of choice, we're going to be able to at least have them connect with a recovery coach. Let's see what questions. Oh yeah, Ascension's role. Another question that I was asked is, what will Ascension's role be with the new Emergency Mental Health Center? Ascension is a part of a joint venture, so we are contributing a fair amount of money to the operations and sustainability of that new mental health emergency center. Aurora, as many of you are aware, will be operationally running it, but Ascension is going to be a funder, and we have a member of our finance team is going to be sitting on the board there. So with that, that's pretty much my update. If anybody certainly has any questions or clarifications, concerns, can let me know.
Barbara has a question.
Sure.
First, thanks a lot for the update, Jim. Just a couple of things to follow up on. With the new Emergency Mental Health Center, can you talk a little bit about how things currently work in terms of how will patients get referred from there to be placed at Ascension, what that process will look like? And also, just the other thing that I just wondered a little bit about, it's good to hear that you're maintaining those medical beds because those are so important, but the need is so great in Milwaukee. So just wondered a little bit about how, the decision to move to beds to Ozaukee County and, what the, and also out of the city and what the impact might be. And if you have any strategy, for addressing that, knowing that a lot of people rely on the services you've historically provided in the city of Milwaukee.
Sure, good question, Barbara. So in terms of the Milwaukee-based, the county of Milwaukee, it's St. Francis, and our goal is to increase that capacity to 25. It's currently at 12, so we're hoping, as we're able to recruit more nurses and clinicians, that we're going to be able to expand that capacity up to 25. Access to either one of the sites will be the same. So if you can present at Columbia St. Mary's Milwaukee, at St. Joe's, Franklin, doesn't matter which Ascension hospital you go to, you will still be able to be transferred to the available hospital of your choice. So since this has happened, we've had probably about equal numbers of patients that have chosen to go either to Ozaukee or Francis, and some actually have decided that they want to go to All Saints and Racine. Kind of depends on where they are and where they're feeling most comfortable getting their inpatient care. Okay.
Any other questions in the chat? I think you did such a comprehensive job, Jim.
I'll take that.
I thought of one more.
Okay, Barbara.
Not a surprise, right? It's great to hear about the recovery coaches that you're putting in place. Do you have any peer specialists in place? Is that something that you're hoping to implement in the future, to kind of along the same lines as what you've done with recovery coaches, which sounds really positive?
Open to using peer specialists. I'm certainly a huge proponent of using them. Currently, we are using them, I believe, in a limited capacity in our outpatient levels of care, in terms of connecting them with some available resources. I don't want to commit to that because I'm not exactly sure what degree that interaction has evolved into at this point. But right now, it's really, we're focusing on the recovery coach implementation.
Well, thanks. That sounds really positive. Great initiative.
Thank you very much for presenting today, and at such short notice, I might add. We really appreciate you coming here, and I know that we had talked briefly that there may be updates in the future, so can we count on you to come back if there are updates?
Absolutely, no
Awesome.
problem.
Okay, thank you. I will introduce the next speaker. We're excited to have Amy Lorenz from Milwaukee County Behavioral Health Services, and she's going to give us an update. It's nice to see you, Amy.
Yes, good to see you too. Good afternoon, everyone. And as Jim said, so many familiar faces, and it's good to at least see everybody in this way. Many of us look forward to the day we can all be in a room together again. It will be very nice to have that happen. So thank you so much for having me this afternoon. Again, I'm Amy Lorenz. I'm the Deputy Administrator for Milwaukee County Behavioral Health Services, here to give an update on things here at BHS. First, I'm going to give an update on our acute inpatient services. As everyone's aware, we are working to transition out of doing hospital-based services, and we will be looking to work closely, and have been working very closely, with Granite Hills, which is a hospital under the Universal Health Services umbrella. We are working towards being able to transition all of our inpatient services to Granite Hills by September, the end of September. That is our hope. We have been working on transferring clients who are receiving services at BHS, either from PCS or our inpatient units, to Granite Hills. And as Granite Hills works to increase their unit capacity, we will then condense. First, we will move down to just one adult unit. We currently have 2 adult units, and we will put that into one unit and be using our observation unit. We also still have our children and youth unit still open. Once Granite Hills is able to open a children and adolescent unit, we will work with them collaboratively to close our youth unit. And then all individuals will be served at that location. Since Granite Hills has opened and even beforehand, we've been working in collaboration with leadership there. We've done several visits at Granite Hills in working with our team members from CARS to work with Granite Hills about referrals, accessing services. And this collaboration is showing itself as last week we received our first referral for crisis stabilization house services. So their discharge planning is working and linking people to the services they need post-hospitalization. In addition to that, we've also been working collaboratively. Our contracted entity, Winged Victory, which is a part of Whole Health Clinical Group, part of MCFI, the Winged Victory has been helping Granite Hills leadership about helping to do benefits counseling, applying for Social Security for individuals, helping people to access insurance. And we are working side by side with them and assisting in those applications and that work to be done, both to help train up the Granite Hills staff, but also to make sure that those services are getting to the clients that are actually in need of them while at the hospital there. So those are a couple of ways in which we are collaborating closely with Granite Hills to ensure a smooth transition for the closure of our hospital, but even more importantly, to increase that partnership that we will need to help people make sure that discharge planning and connection to services post-hospitalization are in place so that people can have a better quality of life, access to services that they need within the community, and hopefully decrease the need for return hospitalizations. So that is the work that we're doing closely with Granite Hills. We are also working with the Mental Health Emergency Center. So with the Mental Health Emergency Center, some of you may be aware that we have several leaders who are part of that board and the oversight of the partnership that has occurred to create the Mental Health Emergency Center. So our administrator, Mike Lappin, the DHHS director, Shakita LeGrant-McLean, our CFO, Matt Fortman, and the head of our mental health board, Dr. Perez, are our representatives on that board. At this time, a lot of focus is being done on the operations of the emergency room. If you've seen the newspaper articles, staffing has been a challenge. That's something that you heard from Jim, and later on, as I'm giving information, I will also talk about staffing challenges that are occurring throughout our community. So Mental Health Emergency Center has had some challenges in being able to secure physicians and nurses. That is about all that I know. But with that, we are definitely prepared to collaborate in whatever way with Advocate Aurora, who is the entity that will be running the psychiatric emergency room. We definitely will want to be a support as they progress towards an opening. So far, we have put aside resources that are a part of our Team Connect, which helps to link people to services in the community and provide bridge services until they're linked with their long-term care provider. So we will be figuring that out with Advocate Aurora leadership as to where those staff may be able to interact and provide services, as they will not be providing direct services inside of the emergency room. All of the staff that are providing direct services in that emergency room will be Advocate Aurora employees, but we want to help as much as possible to ensure that people are getting support services and referred for services that they need post that being seen in the emergency room as well. I know that Advocate Aurora will also have their own social work clinician type staff to do discharge planning. But we want to be a part of helping to link people to the resources that they need, as linkage and follow-up is one of our main goals in our crisis services. Some of the other questions that Barbara had shared with me were in regards to updates on our crisis services, and want to share that earlier this year, we did work to integrate our adult mobile services and our children's mobile services. We've had them under the same leadership for 2 years. Nope, probably before the pandemic. I always have to remember that did happen. So probably about 3 years that we've been working together under crisis services for the adult and children teams. We, as a part of our movement towards air traffic control model, we knew that we would work towards integration, but we were not expecting to do that for about 2 more years. When we would be all in the same physical space, as our plans are to have our crisis services will be located at the in collaboration with Outreach Community Health Center on 2nd and Capitol. OCHC is building their new building. Once that's completed, they will shift some of their resources around and move people into the new building, thereby creating space that we will then rent from OCHC, where all of our crisis services, adult, children, and even CART will hopefully be housed all together in one hub where they can easily move throughout the city and improve our response times. And at that time, we will be moving towards an improved dispatch model that we hope will work. And by that time, we hope will be closely in partnership with the Office of Emergency Management, so that we can have at that point a co-response that could be occurring when people are calling 911, and whether it's EMT, fire, or police that are needed, that we could actually respond. And if it is a sole behavioral health emergency, that we would be able to assist, and therefore not have the need for emergency management services of the other types to remain on scene. So we've been in conversations for 1.5 years or more with OEM on that, and that is also a part of our air traffic control model. So with that, we were planning to do this integration a little further out, but we definitely have seen a change in the number of calls coming in, and have had some of our own staffing issues as far as that for clinical work. Many of our clinical services are done by master level clinicians. About 4 years ago, we changed the requirement. Before that, you had to be a fully licensed clinician. And we have for some years now been actually hiring individuals who are in training, whether they're APSWs or LPCs in training, to gain their clinical hours while a part of our crisis services. Our children's services does have some bachelor's level positions, and we are open to bachelor's level positions now for our newly created 3rd shift positions. So with those, some of the hiring challenges we are having, we did switch gears and increase the timeline for our integrated model. And so our goal now is to have that on every shift. That's 1st and 2nd shift, 7:30 a.m. to midnight, that we do have somebody who specializes in children, youth, and young adults. We are currently able to do that 7 days a week on a mid shift. That's 11 to 7:30 about timeline. But we are actively hiring and training people. And as they get hired and trained, we are expanding those hours. So we're working on this integration, as we really kind of do, also with, CART, our geriatric specialists, and also with the community consultation team. During the pandemic, we have really been able to do a lot of integration with CCT, and they have been a huge support of the team, whereas they're able to use their specialty of working to support individuals with intellectual and developmental disabilities. But also when they have time and availability, they're able to do our standard mobiles and be out in the community assessing and providing services to adults and their families as we can, all together as one team. So that's some of the big updates regarding our mobile teams. We have also been working on being able to expand our crisis assessment response teams. And those are our teams that are co-responders of clinicians along with police officers. We have our MPD team fully staffed. We are working on getting to full staff for our sheriff's department. And we do have coverage available for the West Allis team on the regular. But again, we do need to hire more clinicians to expand the sheriff's department. We're able to just do one shift per day, 7 days a week, where we hope to have at least 2 shifts per day once we're able to do additional hiring. Also want to update that we continue to work with our new crisis stabilization house vendor. So the New Horizons Crisis House, that RFP occurred 2 years ago, and due to numerous issues, delays, many COVID related, between buying property, having a property, remodeling a property, the cost of doing remodels, we have had to pivot that project probably at least 5 times. And so I'm happy that the agency overseeing that project is putting in and will be hoping to close on a location on the south side of Milwaukee, where they will create a 15-bed facility that we will have all housed together on major bus lines in a historic building that is also ADA accessible. And this should be really hopefully the right site for our stabilization house services. When that occurs, we will then end the other 2 houses that we currently have and just go with that vendor. And I want to thank Broadstep for being willing to continue as our vendor during this interim time being, and to help us serve individuals who need crisis stabilization services post-hospitalization, or to help them prevent a hospitalization. So we continue on with that. And then once we do change to the new vendor, it will be modeled a little more, it will be more similarly modeled to the crisis resource centers, in that all of the services will be provided by the vendor, and our mobile team clinicians that typically provide the clinical services 7 days a week at those houses will now actually be solely focused on answering the crisis line and doing mobiles in our community and doing follow-ups. So again, this is all of our efforts and planning to be in line with a more air traffic control model, where we can be dispatched more quickly throughout our community to respond to the community needs, and be able to be there and not have to have people waiting as long for mobiles, and being able to provide that service. So it's really going to help us to have more manpower and resources to do just that. Our crisis resource centers continue to function and do a great job. We remain with the 3 CRCs in town that have a total bed capacity of 37 beds, and are pretty regularly full, and resources being used there at the CRCs. Out of the questions that Barbara so kindly shared with me, one of the other questions was about what are some current barriers? And I'm going to have to bring up that one of the largest barriers that both Milwaukee County BHS, and also this is something that we hear from almost every vendor of every level of care and service, is that hiring, recruitment, hiring, and retention has become extremely difficult. It really, whether we're talking staff that work in our group homes, to care coordinators with CCS, to mental health professionals, whether it's our mobile team or CCS, or any outpatient type service, we are all service areas are really struggling with hiring. We need to continue to partner with our places of higher education to continue to try to attract people to what we had normally referenced as being the helping professions. We need to expand and change how we do services to include more paraprofessionals. But really, there's just a decrease in individuals hiring within our community. And we are in a place now where many of our services require people to work in the community doing face-to-face work. And we are now really competing with, instead of just locally, we're actually competing across the nation, as there are so many providers that now are providing telehealth Monday through Friday days, and you can be assured that you are going to work from home. So us attracting people who are willing to be out in the community doing services is really a great challenge. And so we are working on a recruitment campaign with our human resources. But really, that is something that I know that many individuals that I see on this call that are leaders of organizations are having the exact same challenges. And so I wanted to just be really transparent with the task force and say that this is a time that attracting people into these fields and getting people to do face-to-face behavioral health services and to help people with SUDs. This is a time where we really all need to be championing in some type of way to attract more people into this field and to figure out how we can increase recruitment of those areas. So looking at time. A couple of other things about treating adults and looking to address family needs overall. Definitely, as a part of the Department of Health and Human Services, we are definitely fully working towards being able to have no wrong door occur, no matter where an individual is seen, assessed, talked to, that people shouldn't have to go through multiple doors to get the services that they need for themselves and or their family members. So we are really considering some increasing of services that are seen at our access clinics now that we are co-located in the community more. Speaking of those, I did miss that, we do have Access Clinic East at 2nd and Capitol, Access Clinic South with our partnership with 16th Street Community Health Center at their newest building on 16th and National. And we will be hoping to move into and start our services at Access Clinic North, which is at Milwaukee Health Services, MHSI, their location on 82nd and Silver Spring. So we have our walkthrough with the city on May 23rd. If they give us approval for occupancy, we'll be moving furniture in, getting those offices set up, and then shortly having teams there offering services shortly thereafter. And, we couldn't be more excited about being more accessible in the community and really starting to think about what else can we do to try to address social determinants. How can we help individuals coming in and anything else that their families may need? And really our conversations for BHS and DHHS overall, having discussions about being a part of Impact Connect to be able to really access the resources in a great technology platform that allows self-selection, people to pick what's closest to their homes or where it is that they would like to receive services from, and ones that address behavioral health issues and many, many other needs that people may need. So with that, I think I've covered most of the areas that were on the list of questions from all of you. But if there's anything else that I can answer, I think we got a few more minutes that I can answer any questions.
I see one in the chat, Amy. Who is planning to work with you related to making sure that your building will be accessible? Just curious, Denise Johnson.
Yep. So that one, that is the reports that I've received back from the vendor of it. I will definitely inquire with them. They are working with a loom architecture right now. So I would assume that they would do a walkthrough on that. Some areas have already been remodeled and done to be accessible. I do know there's one area of the house that is not. And so they're going to have to look in and see if that can be become accessible and how to make that happen. Good question, Denise.
Barbara has a question.
Thank you, Mary, and thanks, Amy. This is Barbara Becker. Appreciate all the good information. So just a couple of quick follow-up things. Really appreciate that you tried to address all of our questions. So I'll mention them both and then I'll be quiet. So the first is, I know you mentioned something about a new platform, and just some of the feedback that I've heard is that just the current website, and this isn't just specific to BHD, but for county services, that it's not up to date and that it can be confusing, and especially with some of the reorganization, of how services are delivered, that's not reflected yet. So that was one area I wanted to bring up and hope that you could respond to. And then the other is, just since the workforce shortage is such a theme that runs through all of our lives right now and is really a barrier for people to get connected to services. I just wondered, are there thoughts about bringing together stakeholders, to just do some out of the box thinking, maybe see if there's some interest in the foundation community about helping in some way, because part of it is incentivizing, young people to go into these fields in the first place and, helping to build a more diverse workforce and so on. So, it's a long-term strategy. So just wondering about any opportunities maybe to work together in that as well. Thank you.
Yeah, those are both great suggestions. The electronic platform, yes. Some sections of Milwaukee County's website have become a little easier to navigate, and some have not become as easy to haven't been as easy to navigate. And so that's one of the areas where we continue to have to work upon being able to do that. I do have to say that one of our newest platforms that have been added on and connected to the BHS website is our Better Ways to Cope. That is all of our prevention work that's being done with some of our supplemental block grants. So we recently did a campaign, a marketing campaign for prevention. And with our partners at Two Story, we were able to get some help in creating a platform that our prevention specialist, Jeremy Triblett, is able to update. And it's really us being able to have access to one that we can try to make the changes on ourselves has been definitely more successful than the ones where we have to be dependent on the Milwaukee County IT teams. But I will take that back, and it is, I just have to say, you're correct. It's one of the areas where we do need to continue to try to improve upon. But I do have to say that check out Better Ways to Cope. It's a pretty good one. So it was very nice to see. And then one of our areas that we have increased upon is our own ability of doing internships and doing partnerships with the colleges. And as we restructure post-hospitalization, us being able to have leadership and resources that talk about internships, attracting people into this field, and doing that both for BHS and also creating environments in which we can do some of that work with our vendors is definitely something that we're interested in. And many of you have probably heard Mike talk about this in previous times. It's something that he's very passionate about, of being able to help people to have an interest, one in working with behavioral health issues. And once you get some people working within internships and having access to it, they hopefully turn into employees who then work with you while they even, if they choose to go to grad school later on, they're able to remain working, go to grad school, and then hopefully continue to choose us or one of our vendors, our providers, as their employer, and they remain within our system working. And so that is definitely something that we have interest in doing on. I see there was also a question. I did at least have a question. I saw Ben had raised a question as well in the chat, and just want to give you guys every confidence that the leadership changes at Outreach have not had an impact. We've been working with a leadership team at Outreach for a couple of years to make our Access Clinic East partnership happen there. They also do our outpatient psychiatry services. So any individuals who are uninsured or significantly underinsured do get resources through Outreach. And that's been a long-term contract, plus many, many other services from CSP to TCM to CCS. Outreach does all of that work. And so I believe their board remained in favor of us being tenants, and we've worked on a lease, and we have a letter of commitment regarding our lease. And Dr. Sanders was present and a part of all those conversations along with their CFO, Julia Harris. And so those are the leaders that we've been planning this with, and I'm very confident in their ability to do all the great new progressive work that they want to do for OCHC, and for us to be able to be a tenant there. That just really makes it such an ideal location for our mobile services. It will be such an advantage that we've never had before, to be able to respond, to be able to use the freeway system, Capitol, Fond du Lac, so many other main streets that we have not been able to easily access to get to places, whether north or south. We're just going to be able to get to people faster than we have before, and also have some other great things of being able to have a larger space where everybody can be in the rooms together. Like, I'm so excited. I'll believe it when it really happens, but CART has always had to be housed with our law enforcement partners, and it would be really great to have them actually be housed and located with our behavioral health services. So we're looking forward to that.
Amy, there was one more question about
Yeah.
vaccine affecting.
Yeah, and being
Area.
able to hire in this field. I haven't had it come up as a barrier. Now, to work for us, you do have to have a vaccine or have an exemption. I don't know what all of our providers require. I'm guessing it's probably pretty similar, but it wouldn't all of a sudden happen regarding the vaccine in such a short timeline, because we are seeing some of this a little bit pre-pandemic. And so I think it just has been, we've gone from, some historical context would be 10 to 15 years ago. If our mobile team had a position open, it would happen maybe twice a year. And when somebody vacated it, we would probably have 25 to 40 applicants for that position. We now have multiple vacancies throughout a year. When we do have a vacancy, we get maybe 2 or 3. I'll even talk about something that our providers talk about. They talk about a workforce that will leave a position, go to another agency doing the exact same role because it's 20 cents more an hour. It's just it's a really different market right now. And because of that, we have to change what we do as an employer. And one thing that makes it really difficult when you talk about with behavioral health is that, if we're trying to prepare ourselves to have where we have staff stay with us 2 to 3 years, like that's our goal in our retention. And you would want it to be more, because seasoned clinicians can definitely, they can provide a better service. They are able to know the resources more. They're able to just know how to support an individual. And so our days of having, clinicians who have been around for a really long time, and, the same type of clinicians who can say like, I can help you. And, oh, your daughter who's 8 has some issues too. I know how to access some of that. This isn't easy work. It isn't things that it takes a while to learn and to be able to not only help the person regarding their behavioral health issue, their substance use disorder, maybe they also have an intellectual disability, but then to be able to also do all that linkage and follow up. And we have to be really good trainers as the leaders of BHS, but it's hard to do that if you're having turnover happening that much. So, we're looking at other ways of doing this, but here's something, for probably 5 years, we have offered a $7,500 sign-on bonus for clinicians. That's a significant amount of money. And that has not even helped us do a really big draw. So I really do believe that there are a lot of things playing into it. But one has just been the same thing that we saw happen across our nation in psychiatry, the same thing that happened in nursing. This has been, due to years and years of people not going into those fields, that we just do not have enough people doing the work. And so I think we're at that point now with social worker, counseling, the helping professions type people.
All right. Thank you so much, Amy. We greatly appreciate your update and everything you've provided us with today. As always, and welcome you back.
Thanks, everyone. Oh.
Yeah. Yes, Winnie thanks you also. So, just in a few closing remarks, save the date. I'll give you a few remarks and Christine can give you a few remarks. June 2nd, we are ready in the budget process for the Milwaukee County Mental Health Board on June 2nd. Be at 4:30, which is also the day of the planning committee for the mental health board. We will have, or for the steering committee rather, for the mental health task force. We have the mental health board finance committee preliminary budget presentation. So that will be at the end of the steering committee. And then June 14th at 4:30 will be the mental health the mental health board finance committee public comment on the proposed budget. And that is at the end of the task force meeting for the June task force meeting. And Christine, did you want to take on from the June 23rd on and then talk about oh, I confused the dates there. You want to go on from June 23rd? I'm sorry.
Sure. June 23rd at 1:30 p.m., the Mental Health Board Finance Committee public comment on the proposed budget. And on the next Mental Health Task Force meeting will be the second Tuesday of the month, June 10th, and it's the intersection of trafficking and mental health. And we'll be providing a broad overview of the human trafficking problem here in the state of Wisconsin and Milwaukee and its effects on mental health and also some treatment resources for people. And look in the chat because Brenda Wesley is talking about the Community Stakeholder Advisory Council. And if we could get more information on that, we'll put that also with dates and things. Brenda will put that on email. Hopefully Brenda can send that because that's important. And that's it. Happy Mother's Day to everybody who celebrates and has fur or human or whatever babies, and hope to see you next month. And thank you to our wonderful speakers. This was a very fact-filled meeting and I really appreciate all your expertise. And the resources for children are out there. Thank you, everybody.
Thank you. Enjoy the weather.